Have you ever wondered how healthcare differentiates from country to country? There are four types of healthcare models throughout the world, and they are the Beveridge model, the Bismarck model, the National Health Insurance model, and the out of pocket model. China's healthcare system uses the out of pocket model. This means that the healthcare that someone receives is usually paid with their own money and does not use help from insurance. However, not all of China's medical treatment is paid out of pocket. They have their own version of universal health care that is paid mostly with insurance payments and taxes, and it mainly supports those in cities who have easier access to hospitals. Rural areas of China end up having to use the out of pocket method more because of inadequate healthcare facilities and lack of specialization in those areas. Overall, China's healthcare system is very diverse and relatively easy to understand. Here is a video to help explain how the out of pocket system works.
Before Social Security existed, there was the out-of-pocket model. As the name suggests, the out-of-pocket model leaves you out of pocket. If you need to see a doctor or need any kind of medical treatment, you'll need to pay the bill yourself. There will be no intervention from the government or from other institutions. You will need to pay everything. The countries that still use the out-of-pocket model are non-European, such as countries in Africa, Asia, and even the United States, where medical costs can be incredibly high if you don't have insurance. If you want to be reimbursed for your medical expenses, then you'll have to take out a private health insurance with a commercial company. Your health insurance provider will pay back your medical expenses in full or in part when they receive your claim.
Now that the out-of-pocket model is explained, here is how it applies in China. The first point is that out-of-pocket spending is mostly used when insurance doesn't cover medical services. As I said before, China has a universal healthcare system, but insurance can only cover so much around the whole country. Although decreasing, China is still 38% rural. This makes insurance a lot harder to use because it can't cover areas when they don't have as adequately trained specialists like they do in cities. People in China can choose a private or public service provider, and they usually choose whichever provider benefits them the most. Those paying out of pocket tend to go with a private service provider to help them pay healthcare costs. In 2010, the integration of urban and rural medical insurance scheme was introduced to help those in rural areas get healthcare coverage similar to those in cities. This seemed to work some, but not dramatically, considering that rural areas are still impoverished from even healthcare opportunities. Insurance can try and do their best to cover everyone, but the diversity and levels of treatment around the country still prove to be difficult. Moving on to some differences in the traditional out-of-pocket system versus what China uses, an out-of-pocket system typically means all costs of treatment are coming straight from the person to the provider with no financial assistance, and insurance will not reimburse it. Although the out-of-pocket system is used in about 40% of the country, a universal healthcare system is used throughout the rest. The universal healthcare system helps cover the majority of healthcare costs, but this only works best in the urban areas. In the more rural areas, the out-of-pocket system is their primary method because of the lack of specialization in treatment centers. A primary care visit is $7.20 in Chinese currency, which is about $2.03 in the United States. This may not seem like a lot, but according to British Broadcasting Centre News, the average income for a worker in rural China was around $690, while those in cities earn $2,290 on average. This makes out-of-pocket payments with no insurance help considerably harder for those living in rural areas because they need to use their money for other things other than healthcare, like food, electricity, water, etc. The cost of healthcare in China varies a lot for the location people live in. For physician visits, specialist consults, hospitalization, and prescriptions, there is no annual maximum in out-of-pocket spending. However, those living in the rural areas aren't even able to get around to types of specialized practices and physicians. People in China spend approximately $262 annually out of pocket around the country, and the majority is spent on prescription drugs. China has safety nets for those who can't afford insurance or out-of-pocket spending, and about 5.5% of the population utilize this for health insurance enrollment. There are definitely quite a few issues with China's healthcare system. the biggest one being the coverage for those in rural areas. Insurance doesn't cover what it needs to, and out-of-pocket spending can be very difficult to pay. In addition to these problems in the rural areas, the urban areas also have their own issues. They are ill-equipped for an aging population, especially those with chronic illnesses. In addition to this, China is too reliant on urban hospitals and have budget shortages. Lastly, they are promoting traditional Chinese medicine, aka TCM, which has a lack of evidence of efficiency. This is a very big concern because if an ineffective method of healthcare is being practiced without evidence of success, it can result in severe negative consequences for patients, which is the last thing that China should be hoping for. Here is a video that further explains some of the issues in China's healthcare system.
China has made impressive health gains over the past few decades. Child and maternal mortality have been greatly reduced, and nearly 100% of its citizens have health insurance. Patients themselves now pay just 32% of treatment costs, compared to 60% a decade ago. However, as more people age and contract chronic illnesses like diabetes, heart disease, and cancer, the system is becoming too expensive to sustain. Healthcare costs are now growing much faster than the rate of GDP growth. Hospitals account for nearly 54% of total health spending. Patients often receive more prescriptions than they need. They undergo unnecessary procedures that do not improve health outcomes. Dissatisfaction with the quality of care received, especially from primary care providers, is increasing. A shift to a people-centered, integrated care model, with primary care at the core of the health system, will help improve services and increase savings. What changes are needed if primary care is to become the centerpiece of China's healthcare system? Boost the status and improve the pay of the health workforce in primary care. Transform hospitals so they are only used for critical cases. Educate patients so they can be actively engaged in their healthcare decisions. Reward healthcare providers for quality of care, not volume of patients seen and treatments provided. With the right regulations, allow the private sector to engage in healthcare. With these changes, China can improve healthcare delivery for 1 in every 6 people in the world and be a model for other countries.
Even though China has its fair share of issues, they do still have positives. China's life expectancy is 76.91 years, which is ranked 52nd in the world. Considering the lack of specialization in physicians in rural areas, this is pretty high. China's infant mortality rate is about 6.8 deaths per every 1,000 births, which is slightly above the average of 5.9 deaths per 1,000 births. China has 1.9 physicians per 1,000 people. China's physicians per 1,000 people is below average, the average being 3.34 doctors per 1,000 people. This is not very surprising considering they don't spend a lot of money on their healthcare and hospitals are understaffed. China shares the same out-of-pocket system with countries in Africa and South America and the country India. These all follow the same general outline, with each country having their own modifications. Starting in Africa, their sub-Saharan healthcare system is one of the worst in the world. A quote from the United Nations Africa Renewal website shows just how bad the lack of healthcare is, saying, globally, 50% of children under 5 who die of pneumonia, diarrhea, measles, HIV, tuberculosis, and malaria are in Africa, according to the World Health Organization. This is a very large statistic for such a wide variety of regular-seeming healthcare issues, which shows the lack of healthcare specialists in this area of the world. 50% of their healthcare payments are out of pocket in comparison to China's 28%. This is mostly because Africa lacks good infrastructure and trained medical personnel. It is extremely difficult for people in Africa to get good specialized treatment, especially because some countries are only able to spend $34 to $40 a year per person on healthcare. Africa's healthcare system is significantly worse than China's, and also puts in perspective how grateful other countries have to be to have access to any adequate healthcare. Moving on to India, it is similar to China in that India is using a universal healthcare system. However, in India, they have free outpatient and inpatient treatment in government facilities. This has proven to be difficult, however, because they have a shortage of staff and supplies for those facilities. For low-income individuals, India implemented the National Health Protection Scheme, which is similar to China's integration of urban and rural medical insurance scheme, to help those who can't afford to get treatment. India spends about 3.9% of their GDP on healthcare, which is a lot lower than most in the world. Above China and Africa, India's payments out of pocket is at 65%, which is extremely high, and that causes about 8% of the population to go below the poverty line. It may seem great on the surface that their healthcare facilities are free, but healthcare inside of those facilities are not sufficient enough for everything. Ending in South America, some of South America's countries have the best ranked healthcare systems in the world, like Colombia, for example, which is ranked 22nd in the world. Colombia's healthcare system has grown exponentially in the past 40 years, mostly because employees are required to pay into healthcare plans. Statistically, this makes healthcare coverage grow from less than 21% of the population being covered to 65% in 10 years, according to the internationalinsurance.com. This could be because Colombia spends about 7.3% of their GDP on healthcare and 9.6% of Argentina's, which is exponentially higher than China's. China has not made any sort of leaps like this to improve its healthcare system yet. However, it's similar to China in that rural areas have worse healthcare than urban areas. Comparing all these areas with the same healthcare model, it shows that China has its ups and downs in their healthcare system and are ranked about in the middle of good and bad healthcare. China and America have very different cultural values that need to be accounted for in healthcare to provide care with respect. In China, making small talk about things like age, family, and marital status is found to be rude and intrusive. When Chinese visit America, they are very surprised about how much small talk Americans have, and they find it rude. In healthcare facilities, to accommodate for this cultural difference, it's best to avoid small talk, like asking if they have kids, for example. This is so you don't come off as rude to them. So instead, make sure you are straight to the point and direct while asking about what care they need and how to help them. This should not come off in a rude tone, but a professional one. In China's business practices, they take more time to make decisions. This can also reflect into their healthcare habits. This means that instead of rushing through the healthcare system, they would much rather take their time and make sure things are precisely done. To adapt to this difference in the healthcare system, make sure that you are covering everything that needs to be covered and not cutting corners. While we might find this time-consuming, it's a cultural difference that we need to be adapted to make sure that everyone is happy and content with their care. It would provide a bad reputation if someone thought that their healthcare was not being taken seriously, so slowing the pace down will definitely benefit everyone. In China, it is typical to do anything to avoid ruining reputation or being humiliated. China even has something called a social credit system, where each person has an individual credit score based on their actions. If they do something bad, like get a speeding ticket or jaywalk, it will negatively impact their credit. This is something that is very different in America and China, and changes need to be made to adapt in the healthcare system. This can be accomplished by understanding that if someone comes to look for help in their health, there should never be any judgment for what they're there for. If it's something that is unusual, make sure to not make any comments or faces in reaction to it. It's respectful to understand that they are seeking help for a reason and don't need someone judging them for what they came to the healthcare facility for. Respect is something that is required in the healthcare industry to give adequate care for everyone. If respect is not given, it is very likely that patients will not return and will question the credibility of their doctor. Language may be a barrier that is very difficult to break during any healthcare interaction, but especially difficult when needing to give instructions about a medication or a treatment. It's not very typical for someone in America's healthcare system to speak Chinese fluently enough to give instructions, so there needs to be a way around it. One solution that shows respect is to have a translator if possible. If that is not possible, have them demonstrate that they know what they're doing after you teach it. Having the patient demonstrate what you taught them shows that they understand what you need them to do, and it breaks the language barrier as much as possible. In regards to touch, it is typical in China to respect other space and not touch others. In cities, they are more than used to being bumped into on the street or subway, but they don't expect the same when in a healthcare facility. It is found to be disrespectful to be touched by strangers, like hugging, locking arms, patting someone's back, and even things like clicking fingers and whistling. To respect this difference, it's important to keep space and avoid touching unless it's for an exam. If this is the case, make sure to have respect and ask if it's okay to touch them before proceeding on checking them out. Greetings are usually nonchalant and easy, and this is continued in Chinese culture with a few differences. China is very hierarchical when it comes to greetings and older generations. When greeting others, they do so with the highest respect all the time. In order to respect this, it is very important to simply greet them with respect and understanding. Know that they are getting help for a reason and keep that in consideration when respecting different customs, like language, touch, and greetings. These are not hard adjustments to make, and it will help make patients feel welcome and accepted everywhere. In conclusion, China's out-of-pocket model has its own modifications. Most of the country may be covered under a universal healthcare insurance plan, but that 28% of rural areas still have a difficult time using that insurance and end up paying out of pocket. The cultural differences are easy to adapt to with small tweaks in care given from healthcare systems. Thank you.